MDS in a minute presents the significant change in status assessment. What is the significant change in status assessment? The significant change in status assessment, otherwise known as a SIG change, is a comprehensive MDS assessment that is completed for a resident when the IDT has determined that a resident meets the significant change guidelines for either major improvement or decline. What does significant change mean? The term significant change is defined as a major decline or improvement in a resident's status that will not normally resolve itself without intervention by staff or by implementing standard disease-related clinical interventions. Is not considered self-limiting, impacts more than one area of the resident's health status, and requires interdisciplinary review or revision of the care plan. Who is eligible to receive a significant change assessment? Any time after the completion of an admission assessment, a resident is eligible for a significant change assessment to be performed. How long does the IDT have to decide if the resident has met the criteria to open a significant change? When a resident's status changes, and it is not clear whether the resident meets the guidelines, the nursing home may take up to 14 days to determine whether the criteria are met. What if a resident's status fluctuates? This assessment is not required for minor or temporary variations in resident status, and in these cases, the resident's condition is expected to return to baseline within 2 weeks. What warrants a significant change based on a decline? The IDT should initiate a significant change when the condition has not resolved within 2 weeks and there has been a decline in 2 or more of the following. Resident's decision-making ability has changed. A presence or increase in frequency of any mood indicator not previously reported by the resident or staff. Changes in the frequency or severity of behavioral symptoms since the last assessment. Any self-care or mobility items that are newly coded as partial to moderate assistance, substantial to maximal assistance, dependent, resident refused, or the activity was not attempted since last assessment and does not reflect normal fluctuations in that individual's functioning. Resident's incontinence pattern changes. Placement of an indwelling catheter. Unplanned weight loss. New or worsening pressure injuries at a stage 2 or higher, unstitchable, or deep tissue injuries. Resident begins to use a restraint of any type when it was not used before, or the emergence of a condition in which a resident is judged to be unstable. Any other reasons? A significant change is also appropriate if there is a consistent pattern of changes and can be met when there are just 2 or more changes within a particular domain, such as 2 areas of ADLs. It is also required when a resident is admitted to hospice services or disenrolls from hospice. What warrants a significant change based on an improvement? The IDT should initiate a SIG change if there has been an improvement in 2 or more of the following areas. Any improvement in an ADL physical functioning area where a resident is newly coded as independent, setup or cleanup assistance, supervision or touching assistance since last assessment, and does not reflect normal fluctuations in that individual's functioning. A decrease in the number of areas where behavioral symptoms are coded as being present or the frequency of a symptom decreases. A resident's decision-making ability improves, or a resident's incontinence patterns improve. When is a change in the resident's status not considered significant? Discrete and easily reversible causes documented in the resident's record and for which the IDT can initiate corrective action. For example, anticipated side effect of introducing a psychoactive medication while attempting to establish a clinically effective dose level. Tapering and monitoring of dosage would not require a SIG change. Short-term acute illness, such as a mild fever secondary to a cold from which the IDT expects the resident to fully recover. Well-established, predictable cyclical patterns of clinical signs and symptoms associated with previously diagnosed conditions, such as depressive symptoms in a resident previously diagnosed with bipolar disease, would not precipitate an SIG change. Instances in which the resident continues to make steady progress under the current course of care. For more MDS in a minute videos, and to see other MDS-related content, check out our channel at MDS, Made Easy, brought to you by the Data Nurse.